Hey, we're live. Well, looks like we survived another week, and that's a good thing because tonight's topic might be the most helpful to many of you. This episode is about foot in the door. Oh, and Bertram is here. We thought
Yeah.
awesome. Bertram,
Hello,
hello,
hello.
here.
Hi.
So again, we're talking about foot in the door jobs, and this is a loosely defined term in our industry for any position that gets billers and coders experience right out of school or upon certification. So foot in the door jobs could refer to jobs that do directly involve billing and coding, and these are the ones that all billers and coders strive for. But some foot in the door jobs are indirect ways of gaining coding and billing experience. Jobs like front desk representative at a medical practice, hospital CSR, which is a customer service representative, medical records clerk, surgical scheduler, prior authorization rep, so on and so forth. These can give you a foot in the door at a facility or group that eventually will post a job for coding and billing along the way. So you get to slowly see behind the curtain and pick up useful skills and talents um, during your role that could help get you into one of these positions as an internal candidate. Some places only, or they give early option to internal candidates over external candidates. So these talking's hard today, but foot and door jobs can be an advantage that if you're willing to take the lesser job just to get yourself into a company, yeah, you may as well do it. So we have three panelists tonight. We have Andrea Pernikoff, and she's been discussing her role as a newly certified CPCA that was recently hired as an outpatient coder at St. Luke's. And then we have Mr. Bertram, Mr. B, and forgive me if I mispronounce your last name, Lansquo.
Lancico.
Lancico. All right, I was
Yes.
trying. And he is the chief person at Renowned Talent. He's going to be discussing from the perspective of a recruiter and the expectations from productivity and skill set that you need in order to get to kind of catch the attention of other recruiters. And then we have Pam Vanderbilt, who is the president of Knowledge Tree Billing Inc. and is one of the top experts and consultants in practice management. And she's going to be talking about advancement, skill set requirements, and how do you make yourself more attractive as a candidate for entry-level jobs. So let's start with some of the easy questions. So Bertram and Pam, let's start with what you would consider to be a foot in the door job. I'm sure I'm underrepresenting what this job classification is, but can you offer your perspective as to what a foot in the door job is?
I'd like to turn it over to Pam, and then on these questions that we have, I can always follow up right after, if that's okay.
Sure.
Ladies
Thank
first,
you.
as they say, right?
You're so
Go ahead,
sweet.
Pam.
I'm going to say foot in the door job is anything that gets you exposure in the medical field. I don't care if you're the housekeeper, janitor in a facility. It's giving you exposure to how operations in the medical field work, right? I work solely on the prophy side. God bless you all that are on the facility side. I don't even want to know. But from a medical practice perspective, getting a job on the front desk, being a switchboard operator, doing AR follow-up, medical records, whatever it is, get your foot in there so you can start building those relationships and start understanding how healthcare works. Because at the end of the day, we're in business to make money. But this is very different than McDonald's, Burger King, and Walmart. We are dealing with patients' health in their lives. And so we are very unique in the business world. And you have to understand how it all works together.
Yeah, absolutely. I would second a lot of what Pam said, and I think it's actually one of the most underutilized strategies on getting hired or getting your foot in the door, especially within healthcare. So there's something about healthcare. A lot of employers really prefer individuals to have healthcare experience. And from almost everything that I'm going to talk about today, I'm not going to treat it as a trump card or an ace in hand. I'm going to treat it as something that helps. For example, having your credential helps. It might not be able to get you the job, right? Having hospital-based experience is going to help, but it might not get you the job. Having some EMR experience and familiarity with that EMR, but it might not get you the job. It's like you really have to build up an application and have a lot of these traits. But I believe getting your foot in the door in any position, as Pam said, even as a janitor, works because usually you will get an email, you'll be an employee, and people will treat you differently. Let's say we both walk into an employer. I'm just a nobody from the street, but I, let's say, have a CPC. But you're a janitor. There's so many things that you can do. As a janitor, you likely get an email, and that email you can go onto the contacts list, and that will give you a Rolodex of everybody in the company, probably even the C-suite, right? You'll even get access to those areas. You can just happen to take the long way to work every single day, or even walk within the office and pass by the billing and coding office, get to know those people, have lunch with them and sit down and start networking, right? And that's really how you get your foot in the door. One quick story I'll share with you is that there was a nurse that I met at a conference. So, we have a national nursing shortage, right? So I asked her, it's like, hey, so congratulations, you're a nurse, everything fantastic. We have a shortage. How long did it take you? And she was a recent grad. How long did it take you from graduating to getting hired? You know what she said? 6 months. It still took her 6 months to get hired, even though we're supposed to be in a national nursing shortage. The reason being, and she said what helped her, actually having an employment opportunity or working currently for the hospital. So as John even said and mentioned earlier, it's a really big help if you do happen to be an internal applicant. And a lot of employers or employees for that company may also know people at other employers of similar backgrounds. For example, you might work closely with a husband or a gentleman, and their spouse may work at another hospital or another potential employer. So really your network is much bigger, especially if you're working for that that potential employer that you plan to do, let's say, coding for in the future.
All right. Let's add you and Andrea. You have the CPCA and you got a role at, I think it's St. Luke's, correct me if I'm wrong, St. Luke's Hospital.
Yes.
And what were some of the things that you had done as to get that early opportunity? Let's tell your story.
Okay, so I had absolutely no background in healthcare. I worked in the field of disabilities for over 20 years, and I went through a program that prepared me to do both outpatient and inpatient coding. So I was prepared for the CPC as well as the CCS credentials. I finished my program in August of 2022. I got my CPC in August of 2021. I got my CCS last February, and when I went, I applied for a bunch of different places, and when I went for my interview with St. Luke's, the lady who interviewed me is the manager of inpatient coding, and she said, it's been a while since we've received a qualified resume. And I didn't ask her what that meant, but I really spent a lot of time educating myself about the revenue cycle. I tried to mentor people who were just starting out in the field. If someone was working on something practice, or they had a test they were preparing for in their own program and they could not figure out how to code something, I would rush to my books, because we used professional coding books, and I would look up what they wanted and give them the answer and try to help them out and do that. I also did not care if a job required 2 years of experience, because I knew how to code, and I wanted to get myself out there to connect with as many people as I could in the field. That really helped provide me with a lot of links, places that were hiring people. I was able to get about 5 or 6 interviews from the applications I sent out. And St. Luke's told me that they do hire new coders, so that was a positive thing. The only healthcare experience that I really had was when I lived in New Jersey. I worked for a developmental center with profoundly developmentally disabled people. So I was very familiar with a lot of the medical lingo. A lot of these people had a lot of profound, medical issues. So I kind of knew that part of it, but I was very, very grateful that St. Luke's gave me my shot, and I'm enjoying it. I'm slowly moving up. I started out doing ancillary coding, so I was doing all the outpatient services that the hospital provides, and now I'm doing EM leveling for their urgent care centers. So I'm working on both the prophy and facility coding, and I'm very, very grateful to my program for teaching me all that, because it just made me feel very comfortable, and it helped me learn things very, very quickly on the job.
Awesome.
Right. But that is an awesome story. Like, again, sometimes that's the way it happens. Sometimes you do luck into it. Sometimes it takes a lot of elbow grease to get yourself into that role.
Mm-hmm.
Let's go back and talk about these foot jobs. So, Pam Bertram, do these jobs exist, and are there enough of them to kind of keep our coders employed, or I'm going to say not just our coders, but our future coders employed? And where should they be looking for these roles? Like, what should they be looking for? I know there's a lot of different names of roles out there, but if they're looking for these kind of foot and door openings, where should they look? And
So I'm going to tell you, if we're talking just foot in the door jobs, of course, there's plenty of them. I don't think there's any lack of positions, regardless of what position you're looking for in our industry. I think that I actually think it's kind of the opposite. I've got several clients who have been trying desperately to fill positions, and they get a bunch of applicants, and they schedule the interviews, and people don't even come in for the interview, or they come in for the interview, they get hired, and they don't show up for the job. So I think kind of on it's the opposite of, are there enough jobs? I think there's not enough people that are interested in working that are applying for the right job. It's kind of been that way. I think it's been that way. It was probably that way before COVID. It got worse during COVID, and it just hasn't really completely recovered. Where should they be looking? I'm going to tell you, your networking is your best friend in any industry. But in this industry, you got to network, and, we don't all work in the same place. There is an amazing amount of knowledge out there. You cannot limit yourself to the 10 miles around your house. So get on LinkedIn, do exactly what Andrea said she did. Facebook, look at the AAPC chapter groups and those different areas on Facebook. I don't think Facebook is necessarily a place to do all your business, but there's a lot of resources out there if you're connecting with the industry pages. Stay in touch with your AAPC local chapters. And if you're not AAPC certified, if you're a HEMA or somebody else, I don't care. Join an AAPC chapter anyway and do their chapter meetings. Get to know the people that are in the industry. And then what do we look for? Anything that says it's healthcare that doesn't require an MD or an RN after your name.
I'll interject.
Very nice.
On LinkedIn, I do a lot of hunting around for different jobs, and under my job, under my job search tool, because people ask me, like, what's open, so I can click on that. I see a lot of jobs under my ideal job, a hospitalist or family practitioner. No, not going to work. But knowing what to look for in these roles is important too, because you're not going to make it as a coder. They're not going to hire you as a hospitalist, or they're not going to hire you as a general practitioner. They'll search it, but they do use an algorithm that kind of matches you based on some things like you may actually search for. But I just had to put that out there. How about you, Bertram?
Yeah, well, I mean, when it comes to I mean, I'll second everything Pam said. When it comes to them being enough jobs out there, I'd say absolutely. But we are not getting the right. I just think people are too full, if, for lack of a better word. I think people are just not hungry enough. It's when you can explain to someone, and we talk about this all the times, whether it's a roundup or it's in a meeting. I'm always telling people, like, just look at the HEMA career map, for example, and then you'll see coder, so you can click on that. And from coder, it's going to spider up and down, meaning you can go to these auditor and management levels, or you can look at all of these patient financial services, billing and collections. And there's a large gap, and this is what everybody doesn't realize. The gap in the industry is that you need to look for the positions that people don't want. And what you do is that you get those positions and then you rock it out. And then once you do that, people are going to know that you are a rock star at doing that. That might become your subject matter expertise. I had Sonia Patel on the roundup last week. She got hired into doing like denials and rejections. And guess what? She uses to this day, and she started her own LLC doing exactly that. But that got her all of the coding opportunities that she wants. Now she's like, well, I can do coding, but I actually found a whole nother subject matter expertise that I'm fantastic at. We are so guided, and maybe we are Google babies, I should say. We're just so like, hey, I want a coding position, and I just look at coding. What would I search for if I was looking? I'll look for something within, as we mentioned, medical records, or something that would actually utilize the EMR. So you can go to the job boards and you can say Epic EMR, right? You can say CPC. Don't just look for medical coder, because facilities call things different things. They actually don't want recruiters and companies taking their coders because it takes so long to get them, develop them, all those things. So they may even call them HIM clerks, just so people can't find them. But if you actually look within the job description, and a lot of things are text-based, you can just search for whatever uses a CPC or whatever accepts a CPCA. I would reverse engineer it on that side. And what should they be looking for? I would say, I'm gonna say this again towards the end, is that they should be looking to really get their foot in the door. You're just starting, and let's be honest, this is a foot in the door job. Even if you have to start at a hospital as a janitor, that janitor more likely has a better chance, if they're on their way to get credentialed, getting hired for that facility rather than somebody fresh off the street, because of the networking capability. It's funny, a lot of times, especially with everybody being remote, a lot of the C-suite's actually in the office. You get close to those people and they know that you show up and you do a fantastic job at whatever you're doing, that is going to have clout. And what a lot of employers are looking for is they're really looking for the characteristics of a winner and somebody that's been successful. Because guess what? If you've been successful within billing and collections and calling, the patients, or sometimes, the payers, and getting those nasty calls and harassed, guess what? You're going to do well as a coder. You're going to do well as an auditor. You're going to do well as a manager, because they realize that you're the type of person that's able to work within the field that you're able to do. And how I actually got started in healthcare to become a recruiter was I was an enrollment coordinator. So I was calling doctors and getting doctors to sign enrollment forms with payers. Nobody wanted to do it. Nobody could do it, but I harassed them because I knew if I do this job very well, it's going to open up a whole bunch of doors for me. And I did that for 3 years. But within that, I met the gentleman that would become my mentor, and still to this day. So I became a recruiter. I worked within staffing, and then time came for me to open my own staffing agency. Guess what? My mentor already had the book. He even recently sold his company for quite a bit of money, but it's like, I've been following this gentleman, and actually he's been like a step ahead of me every step of the way, and I'm still getting mentored to this day. All of that wouldn't have happened if I didn't have that foot in the door job. So, we can all have a really big difference within what we're looking for if we are just willing to do what it takes to get the job done. And just remember that it's just a job. You're just going to do it for 6 months, for a year, 2 years, maybe whatever, but it's just a job. And then you can still be applying behind that to get that real hands-on coding position that you're looking for.
Because in the end, it's all about putting food on the table, right?
Exactly.
Work is work. So we did talk about on what the benefit is to taking a foreigner job, but are there any disadvantages to taking that role early on? And how can you kind of compensate for that? Like, what's the best way to overcome, taking one of those roles when you put you at, some kind of disadvantage?
I'm
talking about.
I think. Go ahead, John. I'm sorry.
No, go ahead.
I think maybe a disadvantage could potentially be that some of these foot in the door jobs maybe do not have the meet your salary requirements to make sure that you can keep the lights on and a roof over your head, right? However, they're, work multiple gigs, do a YouTube channel, do something so that you can continue to grow your career in a foot in the door job that may not be able to cover all of your expenses, but it still allows you to continue using your skills. Honestly, that's the biggest disadvantage. The only other thing I could potentially throw in there is if you're really good at it, particularly if you're in a smaller organization, it may be hard to get out of it because they know you're good and they can rely on you. And that's the only other potential disadvantage I can think of.
Yeah, that's what I experienced. I got pigeonholed. So doing the enrollment coordination so well, they're like, and it was funny, other folks they hired within the same position, different divisions, none of them lasted. So they even had somebody fly from Texas to view me and work with me for a couple of days to like find out what's my magic sauce, but they realized it's just a person, it's not necessarily the job, right? And that happens. But then when it came to me actually wanting to do something else, and I communicated this with my manager from day one that, hey, I'm a college graduate. I'm not just here just to file papers and do FedExes all day. I need to do something, but I'm willing to I'll help you out. You help me out, and then we'll just make it work. But you may get an opportunity that they may promise a lot, but they may not really provide a lot, right? But what was so fantastic about that opportunity, even though between my manager and myself, that relationship went toxic, I had a whole network and full of people. I even had letters of recommendation from managers. And at first, I got some eyebrows about it, like, hey, what are you doing? And I said, well, remember from day one when I interviewed, like I was just doing this just to like get on. But I said, it was my girlfriend at the time, my wife now. I'm like, I got to get married. We got to have kids. I can't survive on X amount per hour. So, what do you want me to do? But I was so good, they wouldn't fire me. And I didn't want it to get toxic, but I was just very clear of my intentions and I was honest and open about it, but through all of that, it was able to happen. So going through that experience, and it took me 3.5 years to actually get that recruiting position. It fueled me so bad. And I wanted that position so bad. It was really the key to my success. If I had to do it all over again and create the master plan, I would do it the same way, because when you are trying for so long and you realize that it's just out of your reach, for whatever reason, right? And I see a lot of rejection online, and I try to encourage people as much as possible. But when you're able to use that just as fuel for the fire, and then you get that coding position, like we've seen on LinkedIn with some recent hires, they're just soaking it up. They're like, oh my goodness, week 1, let me just share with you a recap. And I love to see that, because that's what it's all about. You realize exactly what they were holding from you. And I think you appreciated that much. And I'm sure Andrea can attest to that. Now that you're finally working in, a coding position, how do you feel, right?
Let me tell you. So because of the fact that I really enjoy coding while I was in my program, I love reading medical records, and I just love knowing that I have a role in helping whoever my employer is bring in income, because you want to get your providers paid. That's the whole bottom line, right? And the fact that I was in a hospital, that the hospital was willing to hire me, I was like, this is amazing. This is it's a well-known hospital. Correct. And it's a big department, and oh my gosh, it was just really nice thing. Well, you have to understand, I'm coming from a situation where the program that I went through always tells their students that we don't need to look for foot in the door jobs, because we already have the credentials to get a coding position. Now, that's not to say that there are students that will take those types of jobs because maybe they really can't stand the work they were doing before, and they just want to get the door right because they know they can do the coding, but they have to wait for an opening. I feel very fortunate that I got what I got, and that I could just start the coding right away. And oh my gosh, it all came flooding back. But I see where people really could have an advantage to a foot in the door job, simply because you want to be if you find a place you want to work for, you get to know the people there. They see you have a good work ethic. And like Pam said, big deal. to show up to your interview, be professional at it, and show up to your job and do what's expected.
Mhm.
Very, very big deal. And I know that it's not always easy to find someone. So that's why I feel like no matter what kind of a position you get in this field, you need to be a good employee. And you're going to learn everything that they hand you. One of the things that I find very frustrating with people who are trying to find positions, so many of them only want that remote position. Some of them want to make a certain salary range, and it doesn't, real life doesn't work like that. So I'm only giving people tips. You need to be able to, if you find something, you might need to go in person for training. I had to go in person for training. And very luckily, I was able to go home after a month and a half. I really lucked out.
Nice. Great job.
Yeah.
So let's talk about that. Let's talk realistically about remote jobs. Like, what level of comfort should a coder have before they even try to take any remote role? Because you're on your own, basically. Go ahead, Pam.
You are on your own. Yes. And in my organization, everybody's remote. So, it's what is my confidence level in an employee that I will never see and be sitting next to? How do they communicate? Are they asking questions? And I think there are certain personalities that are not cut out for remote work and probably shouldn't apply for those jobs. But aside from that, it's not wrong to apply for the job. But if you're fresh out of school, particularly not an actual school for coding, but a short credentialing preparation course, you probably don't have the skills that you need yet to be working completely independently without having somebody that you can go, I need help. Help me out here. What am I doing wrong? Why am I not looking this up correctly? Why can't I find the code? And so then it comes down again to personality and that communication. We use Google Chat. We're chatting with each other all day long. We can open up and do a quick screen share. We can do all of that. If that remote job does not give you that flexibility, it might not be the right place until you have a little bit more experience under your belt.
Yeah. And I think also having realistic expectations, working remotely is exactly that, working remotely, right?
Yes.
It's not necessarily
Not
like,
childcare.
it's not like, oh, well, I'm on now, but I just need to get my 8 hours in by 10 p.m. or flexible schedule. So I'll kind of like do what I want. And then, oh, I had to go into my son's school and stuff. I always tell people, like, you're really shooting yourself in the foot because, I mean, even if you're in an office, how like would you be doing that, right? I'm not saying like I had a live the other day and I had my son's school call because he bumped his knee and stuff. It was fine, but it's like things happen. We all understand, but are you really literally going to shut down your day and not work because of something that you cannot control? And let's say he's going to get picked up or come home from school in a couple hours. So you have to be as professional as possible and treat it like that. But I think the internet has sold remote as you're working from home and hey, I'm in Tahiti or Bali and I'm doing work, or I'm not really working, but they think I'm working. Like it's not like that. They can see, we can all see who's on, who's active. We can all see, or if you comment and let's say you're not there, do you want to be the person to have to explain to yourself, like, well, to your boss or supervisor, yeah, I'm sorry, I couldn't be there because of this. And what I tend to see happens, and I'm sure Pam has seen it a million times, what happens is that those people just work themselves out of a position. They'll just be like, oh, well, yeah, I got sick and I couldn't do this. And they're really like interviewing while this was going on. So is there really like a comfort level? I think it depends on the person. I think realistically, if somebody has never worked remotely before, they probably want to have some more of an on-site experience first. Then you see, or you transition to do that some days a week remotely. And then maybe during holidays or extended periods, you do that more frequently. I mean, probably 6 months, really depends. But it's a shame. Some people will be perfect for the job, have all the credentials, all the experience, but because they couldn't manage their lives to let them work remotely, they couldn't work remotely. For example, in my household, we call this place the office. So I have two kids, 6 and 4, and they're not going to come in here during this call because this is the office. I treat this like this is my office. And yeah, they're going to have interactions and we're going to have things that happen, but I'm not disturbing my day and no one is here while I'm supposed to be working. Because I mean, we're working, we're talking to clients, right? We have things that we have to do. I might be outside to have a call. That's fine, but like if you treat it with respect and if you act like you would in a real workplace, then it's usually going to work out for those individuals.
So this is my office. My office is actually outside. My husband and I both work from home.
Nice.
And I can't stand being cold. So the AC running, we live in Florida. If the AC is running, I have to be outside where it's 90 degrees. So this is where we established my office.
It's not 90 degrees today though, Pam.
Oh, no, it's not. No, 2 jackets. Because in Florida, we don't have winter coats.
Yeah, exactly. They don't exist here.
As for my remote experience, so the last job that I had, I was a case manager, and we were all sent home to work at the beginning of COVID, and we all worked from home for well over a year. And I found I loved it. I absolutely loved it because I couldn't be distracted by my coworkers stopping by my cubicle, and I was able to sit and type and do everything I needed to, and I was able to do Zoom calls with people. I didn't have to leave my house. It was great, and I still got plenty of work done. So I said, okay, when the time finally comes that I'm working as a coder, I will have no trouble doing remote work. And one of the things that I wanted to be able to show an employer was that I could be productive at home.
Mm-hmm.
We had to do, as an ancillary coder, I had to do 250 encounters a day, and I reached that in the office. So I knew I'd be able to do it at home as well. And now with the urgent care encounters, I have to do 75 a day. And they started a spreadsheet because there were some coders on our team who, I don't know if they weren't meeting production or whatever the situation was, but they wanted to hold us accountable for what we're doing during the day. But I said, I'm already doing it. It's not like I have to batten down the hatches and start working. I'm doing it anyway, so it really didn't matter. So remote coding is great. I love it.
They were probably using you as an example, like, hey, if Andrea can do it, why aren't you doing it? And that sometimes happens. So take charge and lead if you have to.
Lead by example.
Yeah.
I have a question.
Okay.
I notice a lot of times on LinkedIn in particular that there are organizations that will specifically ask for a CPCA. And most of those organizations, it looks like they are risk adjustment, HCC coding.
Mm-hmm.
I'm curious, is everybody else seeing that? Is there something special about HCC risk adjustment coding that makes it different, that the less experienced coders are more attractive to them?
So I looked into that while I was job hunting because they were offering the same amount of money per hour as I was making in my current position. Not my current position, but the one I had. And I did speak with a recruiter for, I think it was the Judge Group. They are a recruiter for, I think it's, Optum. So I spoke with a woman, and they have it. You're a contract employee. You get absolutely no paid time off. You are required to partake in a training that lasts Monday to Friday, 9 to 5. No, it's 8 to 5, 8 to 5. And you cannot take any time off during that training period. And then depending upon how fast you go, then you have the opportunity to be hired by whoever you're contracted for. And I was noticing that too. Last winter, they were hiring hundreds and hundreds of people who were all CPCAs. So everybody said, "Oh my gosh, I'm finally going to have a job as a coder." But there were people who really weren't going very far with it because you needed to meet certain criteria to actually get hired by them. And now they just laid a lot of people off.
I'd like to add to that. A lot of these HCC roles, they're like 8-month projects, 5-month projects. So for them to hire away a long-term CPT or might not be part of their hiring plan. They want to bring on new coders that apprentice because this may not be a long-term process. It'll get them experience, but it's not something to keep them employed long-term.
Yeah. I mean, at that level, it's really a machine, and I mean, there's always opportunity, but it's just, I think this is a whole nother conversation, but you just have to be very careful because a lot of these companies, it's going to be guilty by association. If you're one of 1,500, how are you going to stand out, right, as a minnow in that type of group? So there's opportunity. Some people rock at it. Some people do get higher up to the management and so on and so forth. But it's a machine, so you just have to be very careful about that. But yeah, that's a good question.
So let's talk to Andrea about her daily process. As a new coder, do you think you do anything that's kind of different than someone that would have experience as a new coder?
Good question.
Okay, so when I first started, a good part of my day, after I learned how to use the encoder and after I learned to navigate the electronic health record, I was spending most of my mornings just learning how to read an encounter. Once I started doing more and more of them, I then spent a lot of my morning going over the encounters that I got incorrect. The manager who trained me would send me a whole list of things that I had coded incorrectly, and I started noticing patterns, things that I was getting wrong repeatedly, so I knew to catch myself before I did them wrong again. And then the number of incorrect ones started going down, thank goodness. I also, we have a claim scrubber called Discern. I guess it was the RA department or AR. I never remember what it stands for. And I was always asking my manager, what are you referring to? I would get notifications from them if I was waiting on documentation so I could completely code something, if I was waiting for a diagnosis because the documentation didn't have a diagnosis. So that was the ancillary coding. I also kind of cross-trained to do other types of outpatient coding when other coders were on vacation, if certain areas hadn't been touched in a while and they were getting a backlog. And then throughout the day, for ancillary coding, what I was asked to start doing was, if I had a question about a certain encounter, I was asked to leave a note for my manager to review. I was sending her emails throughout the day, and then she said, your emails are getting lost in everything else I'm getting, so just leave me a note and put it on hold for the manager to look at. So now with the urgent care encounters, unless I'm completely confident in how to code something, I have a new manager now. I will send her an email or something on Teams to ask her, this is where I think it's going. Do you think I'm right here? What am I leaving out? What am I not seeing in the encounter? So I do spend part of my day writing questions if I have questions. But for the most part, I'm on my own at this point, and I'm enjoying it. So that's basically my day.
Anything you could have been a lot better
I
prepared
hear a
for?
lot of background noise. I'm having a hard time hearing you.
Yeah, I'm not sure where that's from. All right. Let's look at slow down. Okay, so question was, is there anything that you feel in your role that you could have been a little better a little more prepared for? And what are some things that you would recommend to new coders that they should kind of aim toward learning before they apply?
Something that I wish had been a little different. I think it would have helped me a lot if I had really reviewed the guidelines for diagnostic coding before I started. A lot of the errors that I made were due to not paying attention to those. I believe there way back when I was in my program, someone in my program had brought up trying to learn different encoders and whether there was a way to learn them before, something to add to your resume. I think 3M was something that I probably could have watched a couple of videos on just to see how it operated, because learning something new electronically for someone like myself was a big challenge. The more and more I did it, the more and more, obviously it became easier. And then obviously using it, I caught onto it pretty quickly. But other than that, I think just being able to ask questions and not pretending I knew too much was I think very important for my manager to see. I think she also appreciated the fact that I was able to talk coding with her. She made it a point of telling me, she said, I can tell when someone has gotten their CPC because they did a crash course to pass the test versus someone who knows how to use a coding book. So she said, I can tell there's a difference in the speed at which someone picks up what they're learning here. And so we could talk coding, and I understood what excludes 1 and excludes 2 were, and how to make sure that something was an initial encounter versus a sequela, things like that. So I knew all those things, and she appreciated that a lot.
All right, Bertram, now I see your mouth's full. I'll ask the same question. But from your perspective, what are things you see as a recruiter that you would wish some candidates would have developed already?
It is crazy in the world that we live in today. Back in my college days, if you had to get trained on some of the software that's available that coders and executives and professionals use on a daily basis, I'm talking about Microsoft Office, it would cost you an arm and a leg. And it was like 5 disks, you had to install all of them and all of this craziness. Now, for an easy subscription of less than $13, I believe, domestically, I don't know what it is in other countries, or they may even have student discounts with that. Now, for even a fraction of the price, you can get the whole Microsoft Office suite. I'm talking Excel, I'm talking PowerPoint, I'm talking everything. And these are tools that folks use on a day-to-day basis. You want to hear a shocking story. So I was working with this one lady, and we'll call her Sally. I like to pick on Sally, everyone. I apologize to all the Sallys out there, but I like to pick on Sally. Sally, I'm telling you, John, I'm working with this lady, and I'm getting all of my coders placed. But Sally is still there because for every job, she doesn't have something. So I'm talking to one of my managers, and I'm like, can you just give me a solid? I'm calling in a favor for Sally because I need to get Sally hired, right? It's not for me. It's not for money. It's like really all of my coders are placed, but Sally's still here. Like what? Like, and my coworker was like, okay, Bertram, if your coder knows Excel, I can get her this job. This job wasn't even posted yet. And I am so like, I'm like a kid in a candy store. So I run to call Sally. Hey, Sally, I got you the job. The only thing you need is Excel. This is what Sally tells me. Bertram, I don't have Excel. I'm like, what are you talking about? You don't have Excel. And she's been a coder because our threshold was the 3 years of experience, credentials, all of that. And she even passed her test. She had a very thorough compliance test. She passed all of that. She just didn't have Excel. And you know what she told me, John? She said, Bertram, you know what? One day at work, it was going to be an after work thing, like a lunch and learn. They were going to provide pizza, and I didn't stay for the lunch and learn to learn Excel. My mouth literally dropped to the ground. Your employer is providing you this free education just so you have exposure, you can put on your resume, and so on and so forth. Ladies and gentlemen, whenever your employer is providing something, and you know what, I was frustrated. I went to the lunch and learns. I like to go to the gym and do other things, but you know what? When they're providing you those resources and those meetings and those things that you can actually add to your portfolio and your resume that you're building, that is what it takes. And I'm telling you, just all the things that we mentioned earlier, people not showing up, people not being responsive. What I'm looking for people to be honest with me. Things happen, your dog dies, your cat dies, but you don't just ghost out on a job, on a recruiter, on somebody that you're talking to, or even in somebody that's trading and helping you. But these people do it. I worked at a new company. I got this big raise and all of these things. And my first inpatient coder, she disappeared with our equipment. She was supposed to start on Monday and she ghosted us. And I'm like, are you serious? And what they don't realize is, and please, ladies and gentlemen, what you have to realize is when you do that, you don't just burn Bertram or Pam or John or Andrea. Guess what? There are a lot of people down the food chain that you're burning. I'm talking about HR has to get involved. The manager has to get involved. Now the manager has to tell the client that also has to get involved, that knows your name, exactly who you are, Sally, and they're not going to give you a job. You've burned 20 people and you don't even know it. And guess what Bertram's going to do? He's going to go back in his pocket, Rolodex, call somebody else. Hey, are you ready? Yes, I'm ready. And we're going to get them going. The employer might be delayed for a little bit, but you are causing yourself a future of pain. And I've seen this on the flip side. These people I met for the first time, Sally 2.0, everything's fine. I submit the resume to an employer. Employer says, nope, no thank you. I'm like, uh-oh, that's not good. You know what she did? You don't need to burn a bridge behind you. You burn a bridge in front of you too for future opportunities. I see this countless times. So I always tell people, you know what? Things happen. I'm even getting older myself. I was young back in the day, 15 or so years ago. Things happen, but you do not ghost people. You just be honest. Even if you got another job, you don't need to explain yourself, but you should tell that employer, I appreciate it. Thank you for sending my equipment. I am so sorry. I cannot do this right now. It's just not the right time for me. I just can't do it. Bertram, plead with them. Tell them I'm sorry. I just can't do it. Let me get you your equipment back. Because even the equipment has GPS trackers on it right now. As soon as they install Microsoft Office, it's going to ping to Microsoft and we can shut that beast down in like 2 seconds. IT puts like 3 or 4 security things on there just so they can shut it down and they can track it. So it's not worth it. And I don't know, the things that I see that people are missing is just the basics. I think it doesn't even come down to the software. I think the software is like the next level. I think it's honesty. I think it's courtesy. I think it's professionalism. I think it's just showing up. And you know what? Your manager or that person that's making buku money every day, there are things that we don't want to do too. But guess what? We show up. We're sick. We show up, right? And I think we need to get that back into America. Because guess what? And I'm not trying to go on this tangent, John, but there are a lot of people that haven't had these opportunities, even domestically. And when they get them, they're taking advantage of them. They're rocking them. They're going to get promoted to the highest levels. But we have a culture right now that people are forgetting the little things when we are all scratching our heads. And I saw Pam shaking her head a lot. You're like, why is this even happening? And it shouldn't happen. You should not get a desk job because you couldn't do Excel when there's YouTube. And you can reach out to Microsoft, download it in 5 minutes, and you can train on YouTube. It's just Sally. Yeah, yep. Sally. Anyway.
You can learn Epic and ECW and all those others on YouTube now too. So there's no excuse.
Even for 3M, what's that? Yeah. There's a VLab through AHIMA. You're a member, you have a school or accreditation. They don't verify that, but you tell them you do, whatever. You go on there, you put the VLab, you do whatever, and you pay the $75 and you have it for a year. It's like, and funny thing, they have the whole module there. So it's not just you have it and you don't know what to do with it. They're like, hey, this is how you log into your 3M. This is how you click on it. And I don't know this from experience. This is what people have told me. But the whole thing is there, ladies and gentlemen. So it's like, if that is the resource, and if you can put that on your resume as an entry-level coder, foot-in-the-door coder, wouldn't you spend the $75? I see people like, we saw a family yesterday. They bought like an 86-inch TV, right? Like the biggest TV you can buy at the store, right? And I'm thinking, what if people took that TV and they broke it up 6 or 7 times and invested in their education? I think it's our goals and our priorities are very much malaligned. I would rather invest in Microsoft Office at this point if I was entry level than a subscription in Netflix or any of those things. Okay.
We had an audience question that you probably have answered part of, but Monique N says, I need to learn Excel. What else is a must? And you mentioned there were a lot of things like encoders and Microsoft Office, but what are some other usual things that people should have some kind of firm grasp of from the IT perspective prior to, things that they wouldn't consider? Like, we think medicine, we think the EMR systems, but there's a lot that you'd have to know as well, like Microsoft Word, Microsoft PowerPoint. Like, what are some other things I may be forgetting?
What is a mouse?
Boom.
Literally,
Got him.
We hired somebody at a previous
Got him.
job. We were senior level auditing consultants. We hired an auditor and we're training her, and she didn't know what a mouse was.
Bam. Bye, Sally.
Bye, Sally. That's exactly what happened.
Bye-bye.
I like to say
and it's so funny because like no one would even ask the question. No one would even ask, you happen to know what a mouse is, right? I mean, if you would ask that, you'd almost be insulting someone. But when we are in such a technological advanced area and someone doesn't even have that, it's just so crazy. So from a software perspective, on the executive side, I'm going to go the whole Microsoft suite. I'm not saying you need to know Access and a lot of this other stuff, but I'll say the 4 basics being Word, PowerPoint, Excel, and
Outlook.
Probably Teams and Outlook. Teams and Outlook, those 5, right? Outlook for email and Teams for communicating, video sharing, video conferencing. Teams, I like it. Yeah, it's like Zoom and all of those other things. But the fantastic thing about it is that I've realized for my team and what we're doing is we don't have to share numbers with, and I don't have to get like a phone number for every single consultant or person that's working for us. If they have the computer, they're going to have Teams. If we need to call them, I can just call them at the computer. Because if it's their traditional 9-to-5 schedule, if I call them, they should be able to answer. Also, Teams has an app, so you can even have it on your phone. So, hey, boss, I'm sorry, I'm at the office. Do you mind if my kids are here? Is it okay to make a call? Yeah, I'm calling you a little bit after hours. Just had this one question. And then you can even message on the app as well. So it's like all the resources are there within that. And probably Andrea, John, and Pam can talk more about the EMR and coding related softwares.
Yeah, there's a lot of EMR softwares out there, and if you work for a large facility, there's a good chance they're going to offer on-site training. They're going to have their EMR trainer sit with you, and you work through modules. If you work in a smaller practice, most likely you might have to learn through the help window. What do you think, Pam, on that?
I don't disagree. In the smaller practices, unfortunately, we lose a lot of our knowledge on our use of our EMR through attrition, because once they go live and do implementation training, those people who got the initial training understand how to use it. But as new people come in and they're doing on-the-job training, they forget to tell them something, or the initial people are gone. And people are trying to do sink or swim. So we really do. A majority of my clients are on eClinicalWorks. And the first thing I do when a new employee comes in is I get them into the my.eClinicalWorks portal and show them how to go access the videos. And then I make recommendations based on their job, which ones they need to watch. And then I'll set up a call and I train their staff on how to use eClinicalWorks so that we don't lose all of that information that was originally done on the implementation. I've got a couple of clients on ECW that have been on it since 2009. None of the same employees are there now.
Yeah, that makes sense. But great job, Pam.
Thank you.
We went through a lot of the topics I had. Questions I want to ask, but one of the big ones is this 2-year requirement for experience. So I know that sometimes this is a kind of a huge buzzkill when you see that on the on any job posting. 2-year requirement minimum. You need a degree. You need a PhD. You need to be 23, be at least 20 years old and 4 years experience. So what is your opinion, anybody, on this 2-year requirement? And is there anything that people can do to kind of override that?
Absolutely, there is. So have a really good resume. There are people out there that are just coming out of school. They've never worked a significant job in the industry that they've gone to school to learn, right? But they've worked at McDonald's or Target or whatever the job is. There are skills at those jobs, even though those aren't in the healthcare industry, that are important skills for what we do day to day.
Preach it, Pam. Preach it.
And I would like to hire some people. Sometimes I go through drive-through, and you get those drive-through people that are just like, here's your food, and they're get out of my driveway and let me get to the next person. They're not really very customer friendly, right? But then you have those people that every day is a great day for them, right? When I meet those people, those are the ones that I'm like, I know this office that's hiring a front office person. Are you happy at what you're doing right now? Because those are the personalities that you want at your front desk. They should be the hostess with the mostest, right? They should be the patient's best friend. And all of the rest of it is trainable skills.
Wow.
So have a good resume. Have somebody like Sarah Reagan, the caffeinatedcoder@gmail.com, create your resume, because she will take all those skills from your past and make it sound like you've been working in the healthcare field with the exact skills that you need for your entire life.
Preach it. Wow. And that's such an underrated strategy, because what is happening? You're not a coder. You're going to the market thinking that you're going to be a coder. You are, not just yet, but you do not know what a coder resume looks like. You just think that if you put on some keywords and you put your education, it's going to be that, but that's not the resume that a coder has. So reach out to Sarah. She's fantastic. She was on the roundup as well. But I would also recommend for each and every one of you to have an experienced coder hiring manager look at your resume just for feedback. Say, hey, I'm trying to get involved in this field. Bertram, Pam, John, and Andrea told me I should probably have my resume reviewed by a few hiring managers to give me some pointers. That is actually the strategy that it wasn't even me, a former classmate of mine in high school said, hey, let me have my manager take a look at your resume. I didn't really get what he was looking at, but that manager provided the most feedback that I needed to actually get my resume looking different, that it can be taken serious by a potential employer. Now, to the 2 years experience, is it required? I would say yes or no. Yes and no, okay? If you're going to be working with an organization that is large enough, has the training staff, and has the capability to bring you on board like Andrea and really get you going and hold you to metrics and keep you productive and all of those things, absolutely, you don't happen to need that experience. But on the staffing world side that I am more focused on, and we are putting out fires, right? We have a client right now and their DNFB is probably 3 times the size it really needs to be. And it's an issue. I'm not going to have the opportunity to bring on somebody in that has less than 3 or so years of experience for that client, right? But are we going to have opportunities, or are we going to get that client's DNFB down that we can probably work with them as to, hey, why don't we actually work on, I can take my firefighters somewhere else, but before we do that, let's get some people trained up for the next 6 to 12 months on exactly what we are doing, and we'll put a subject matter expert and lead to guide them and make sure that they're okay, and also provide those savings to the client. Yes, we can make all those things work. So what I would say is, if you're going to be working with a health system or an employer that is large enough to have enough staff and people around to help train you and make sure that you're doing everything good, and you can not always have to bother the manager. I believe Andrea said that she had a few other people that she can kind of like ask questions to that can kind of steer her on the right track. Yes, you don't happen to need that full 2 years of experience. Those employers know that, and they will hire folks that don't happen to have that. But when you're looking to work for a consulting agency, a vendor, anyone that is not a hospital, and you're looking to make big money, big boku bucks, unfortunately, the reason why that is because they have to go out and they have to put out fires. They're like this one client that we have, this high DNFB, essentially we were able to get the coders, and we're getting the coders in there because it is such an issue. They don't want any new vendors. They don't necessarily need any new coders, but the level of the work that's there and the issues that they're having comes down to them not having the right staff. And I think what we need to do is we also need to segregate the market. A lot of vendors, what they're selling is that they're the one-all solution, and they're just hiring any coders that they can find to be these people to put out the fires, when that's not the case. You need some coders at a lower level, or people that can be at a lower level, to do the job. But what are they doing? No, I'm just going to be competitive. I'm going to hire from somebody else, and we're just going to run business that way. So we're looking to do things very different, but I think that can be a very big breakthrough for a lot of you, because you're also wondering too, the recruiters and the people that I'm seeing, why are they not giving me the opportunity or the time of day? And it's because those are not the positions. I mean, I'm telling you, you get hired, and they're going to do an audit on you that first week. And if you don't pass that audit within like that second week, you're done. So you're not even going to have time to update your resume, far less your LinkedIn, if you don't swim at that level. It is truly a sink or swim. So.
So regarding resumes, what I did was my coding program recommended one business. They only recommend one business. I use Resume for Coders. And basically, I don't think that they took my skills and kind of transformed them into the coding world. They kind of formatted it in a way to showcase my coding skills, and I did adjust it for every job that I applied to make sure that keywords were in it. I also went on LinkedIn, and if any of my connections had a resume posted, I would look at theirs and see if there were any skills they had that I had as well, and incorporated those into mine to make sure I covered everything. So I did that, and it was a process, because your resume shouldn't say stagnant. It's, as you are working, whatever I could think of that I knew I could do that could be potentially part of a coding job, I would try to stick in there. And I kept it on one page. I'm from the old school. I can't say from the old school, because back 20, 30 years ago, there were people who had resumes 2-3 pages long, and that doesn't go now. So I really tried to, I adjusted the font if I needed to, and I adjusted my margins if I needed to, but I got everything in there. Now the 2-year requirement. So I'm in a chat now with a couple of people who are either graduates of my program or currently in my program. And so far, 3 of us or 4 of us have gotten employment as coders. Okay. And where was I going with this? Oh, where was I going with this?
The 2-year rule or so, is it really required?
All right, so I'm going to mention my friend Rivka Stearns, who is becoming very well known on LinkedIn.
Yes.
She played a very large role, actually. She last summer, when I was applying to positions, she was sending me links to positions on an almost daily basis. She was such a cheerleader for me.
Wow.
So yeah, she's just incredible. Even though
and she wasn't hired as a coder yet, but she was sending those jobs and sharing them with her network.
Yes,
and might we wonder why she's now working as an inpatient coder? All the seeds she planted. Good Jesus. Oh boy. Oh.
So anyway, one of the things that she taught everyone there's only about 5 or 6 people on this chat. She's always telling people, you have to look and see what the requirements are in the job posting. Not every employer requires 2 years. Some of them prefer 2 years. So that's where she said, I'm not going to waste my time on a place that requires what I don't have. So she oh my gosh, the amount of places that she amassed in her spreadsheet, because she's the queen of spreadsheets. I ended up sending out my resume to 75 businesses, and some of them to multiple positions. And she sent out hers to many more than I did. She also ended up with many more interviews than I did. She was like me. She got one offer, just like I got one offer. But it was, it just goes to show you that you really, if you have a good resume and you have good people skills, you show up to all your interviews, you don't need to take the A off your CPC.
There
That's
you go.
number one.
Good
And
job.
number two, you don't require 2 years of experience, because if you can sell yourself to your employer and come up very honest, and be just let them know what you can do for them. People can tell your sincerity. They can tell that you're very dedicated and that you really enjoy the field. And it's not just another job to you. It's really not. I'm so grateful that I'm doing the job that I have.
And Andrea, I understand exactly why you got hired with an A. Because you did the research, you got on LinkedIn, you connected with people, you stayed engaged, you didn't just let your resume be the boring old resume. You put the work into getting your job. And part of the reason there are people out there right now that have been certified for 6 months, 2 years, 5 years, and they don't have a job is because they're not doing that. They're waiting for the job to come to them instead of going out and getting the job.
Correct. Oh my gosh, all the people that I see posting on beginner coder sites, and they all expect people to throw job openings at them. And I thought, I grew up before there were computers, and I used to look in penny savers and job wanteds and make phone calls to get interviews. And obviously that's not the majority of people nowadays. I know I can't use that as an example, but I'm used to doing my own work. And that's what you have to do as a coder. You have to do your own work. You might be lucky enough to have somebody that you can ask questions to, but the last thing you want to be doing is bothering a manager when they have enough stuff to do, when you can look up something yourself. And that's what the whole job hunting process is finding your way, finding places that might be good for you. And you have to do that on your own.
For me, what I would say in this is that, man, John, wonderful lineup. Thank you for putting this together. I'm looking at the comments. They're blowing up. Like, there's just so much value and gems that each of you have shared. And one thing I like to just say in closing is that I think, ladies and gentlemen, you just have to remember that it's a marathon. And not just this like job hunt that you're on right now to get your first job. I'm talking about your career. This is really your career within revenue cycle and coding. And I'm not just talking about coding, I'm talking about revenue cycle. There's a much bigger piece. When I got started 14 or so years ago as a recruiter, I wouldn't have imagined to now that we actually have our own coders and we have our own clients, and we are going to be affecting change, not just being another staffing vendor in the process. But I remember when I was just like each and every one of you, applying and getting rejected, having phone conversation with that one hiring manager at that health system, and that health system owned all 12 hospitals in our area. So now I just got out from all of those facilities. I can't call them again. I can't apply because nothing has changed with my resume. And what I realize is, as Andrea says, you just have to be, I think, like, you kind of have to be old school, but you kind of need to hustle, meaning you kind of need to be busy. You need to be involved. You need to participate. You need to be good to people. You need to be able to help, even if nothing helps you. I can share you countless stories about people that just showed up to meetings with donuts, their resume, and some coffee, and just introduced themselves, gave the donuts, sat in the corner, and at that very meeting, they met the person that would hire them, because they said, nobody comes to this meetings with donuts. I'm always hungry. What is your name? I need to remember your name. And guess what? They hired them on the spot. I had my live call today, and that person showed up, and it's so funny because she's still at that employer today. If you're willing to go above and beyond and show people that this is not just another job for you, but this is a career, and you can be the most best and fantastic employer for them, the world of opportunity is going to come to you. And sooner or later, before you know it, you might even have your own little coding agency and doing coding or billing, whatever that is, or new subject matter expertise for clients across the country. So I would say, if you are on this and you happen to view us today, connect with all of us, follow our journey, network, serve, get involved. For some of the speaking events and stuff that I have to do, I mean, I'm even paying to go to speak, right? And that might not even bring any job opportunities or business back to my business, right? But what am I doing? Planting seeds, getting to meet people, talking to people. That is priceless. You can't even do that, right? And since a lot of people are, or even the vendors are not sending their folks to, let's say, some of the smaller meetings, guess what I'm doing? I'm going to all of them. I'm gonna eat it up because they're not gonna be there. Find your gaps too. Find what people are not doing that you can do, right? Like the on-site jobs. If I were you and I was an entry-level coder, every on-site position, I am going. If I have to move to a new place, and guess what? It might be on-site, and then they don't tell you it's actually remote. They just want you to apply because it's a coding position, but not because it's remote, because a lot of people are applying just because it's remote. Search for on-site positions. Work in the gap. Find out what's not trendy. Do that very well. And then guess what? The whole world of opportunity will be there for you. And even if it's not there in that position, while you're working there and learning the industry and your network and all those things, you can still apply for other coding positions. And when you resign, I only resign because I finally got a coding position. It's remote, all of this pay and all of this stuff. So, just if you're going to do it, I would say do it. Be fully dedicated. Be all the way in. Don't just dip a toe in. Oh, I just got my credential, or I did this crash course and I got it, but I'm not really sure. Those people never make it. I saw this during COVID. They had three or four ladies. They're always on LinkedIn, like every other day, posting, "Hey, I'm a newly credentialed, newly credentialed, newly credentialed, newly credentialed." They networked. They got together. By the end of the year, I saw one of these HCC coding positions. Right, I was like, "Oh, cool! I'll reach out to them." All of them were working. Why? Because they're putting themselves out there, and they were not waiting for a client or a hiring manager to call them back. They were putting themselves out there, and they were going to find the jobs. If you have that determination, you're not going to be on these calls or these types of calls in a year because you're going to be fully hired in your position.
How about you, Pam? Any last minute comments?
Yeah, I so totally agree with what Bertram was saying, and stay engaged, invest in yourself. And I'm a officer for our local AAPC chapter. We have so many people that join us virtually that I honestly believe probably 5% of them log in, walk away, and aren't even paying attention just to get a free CEU. Those people are not investing in themselves. But because we're virtual, we went from 30 attendees at a chapter meeting to somewhere between 300 and 500 at most of our chapter meetings.
Wow.
And these people are investing in themselves. I'm really very fortunate. I have a lot of really good friends in the industry who speak at a national level. I trust their education. I know it's compliant education. So we have great speakers, and the word has gotten out. And so people are coming. They're hungry for the education. Be the hungry person. Go get the education. It's not about CEUs, it's about the knowledge. And there may be times where you need to invest to go to a conference or a retreat. You may have all your CEUs that you need for the year. I don't care. Go, because it's the people that you meet when you're there and you build your network with that are going to take your career and launch it like a rocket. You have to build the relationships. The education, honest God, I speak usually somewhere between 6 and 8 conferences a year. And I don't go to any of them for the education. I do get the education, don't get me wrong, but it's secondary. It's the networking piece. And if you stay engaged, if you keep reaching, if you keep driving your own career, you will be successful.
And Andrea, any last minute comments before we close up shop today?
Yeah, I think I see too many people who aren't even in the field yet. They don't even have a job coding yet, and they're looking to amass all these credentials to try to make themselves more marketable. I think the main thing is to, like we started discussing earlier, just get into a position someplace in the field, see where you're headed, because sometimes people start off in a particular position and then they find it's not satisfying for them and they want to learn something different and learn a new skill. Like I really enjoyed, I guess it was a couple of weeks ago, where there were emergency department coders, and that is actually a personal goal of mine. I'm hoping that once I have my A removed, which should be this summer, I just keep listening for when there are openings in my hospital for people who are leaving, and I'm hoping to move up and do other types of coding from what, I mean, not that I don't like what I'm doing now, but I really want to expand myself and just play different roles and do different things. And one of the great things about this field is just the potential. There are so many parts of revenue cycle that you could get into, and you might find you are helping out your department in something that you never tried before, and oh my gosh, I didn't know that this existed, and you're really finding to get a hang of it. And so just keep your eyes open for different opportunities.
Great. Well, I'd like to thank everybody for joining us today. This was a great conversation. And again, we have Mr. B. If you want to follow him, he's got so many things out there. Renowned. He has a website, www.renownedtalent.com. He also hosts lists like 80 times a week kind of webcasts on LinkedIn.
Sounds like a hater.
Everywhere. You should watch a few. There's a lot of insight into those. So check those out. I think
thank you, John.
On YouTube. And then if you want, there's more. You can ask Miss Pam Vanderbilt. She's the president of the Knowledge Tree Billing, but she's also out there very active on LinkedIn with the APC. Reach out to her if you want to ask more questions. And of course, there is Andrea Pernikovs, who can point to some of her colleagues that are in the kind of same boat she is, so she can point you into some direction as well. And I am, as always, John Piaskowski. I am the intern at Differential Coding and Services. We handle educational things just like this, and actually only this. So we have a lot of episodes previous, and we have one next week on a topic where you won't hear me talk at all: obstetrics and gynecology, something I have no knowledge of whatsoever. So it's going to be one where I'll be sitting reading a newspaper. But catch us next week, and we'll have a lot of more valuable information. Our goal is to talk about different coding roles to see if this is what's right for you, and if it's something that you would want to pursue as a career interest. So again, we'll see you next week. And I want to thank all of my guests for joining us today. And
thanks for having us, John.
Thank you, John. It was wonderful being with all of you.
Have a good evening.
Thank you.
Thank you, guys.
Bye-bye.
Have a great night.
Bye-bye.
Bye.
Bye.